I was wrong. There's one tiny little bit we need to finish up for the skeletal system. So this will be our last skeletal lecture. It'll be a short one. And then our next lecture will start the muscular system. The last bit about our disorders of the skeletal system involve the spine. One of the more common, and you've probably heard about, is scoliosis. Scoliosis is an abnormal lateral curvature, usually in the thoracic region. What we're talking about is the thoracic vertebra, the 12 vertebrae that we identified in lab. There's an abnormal lateral curvature. There is typically an anterior-posterior curve to the thoracic region. We're talking about a lateral curve to one side or to the other, to the left or the right. It's quite common in late childhood. Causes abnormal vertebral structure. It makes sense. If you have vertebra where the body is not evenly thick, you're going to get kind of a tilt one way or the other. A disease that paralyzes muscles on one side, so the not paralyzed muscles are going to pull stronger and cause a curvature. Or simply muscles on one side is stronger than the other. This is typically what happens in late childhood. Most folks that do have scoliosis, it is mild. Most folks typically don't have it. You might remember in middle school, you were typically screened by the school nurse to see if you had scoliosis. The nurse would have you curve your back while facing her, kind of touch your toes, and that would allow the nurse to see if in fact there was an abnormal curvature. Again, I'm going to sound like your mom. The best way to prevent this, and again, for the most part, you guys are past it, but the best way to prevent that is to, instead of using your backpack on one shoulder looking all cool, use both straps so that both the muscles on both sides of your vertebral column are working in concert with one another, so one side does not get stronger than the other. Treatment, it depends on how severe the scoliosis is. In very severe cases, you wear a body brace. In very, very severe cases, you may need surgery, in which case they're going to put metal rods on either side of the vertebral column to straighten it out. This individual has scoliosis, and it kind of looks like she's given attitude and she's, jutting out one hip, when in fact, if you look on the far right, that is the x-ray of her spinal column, and it's curving to the right and then back to the left. That is obviously not normal. Kyphosis is next. This is an excessive concave curvature of the thoracic region. It's common in elderly folks, typically women. It's called the dowager's hump. A dowager is an old, wealthy woman. Common causes are osteoporosis, rickets, and osteomalacia. Kyphosis is that thing we see in again, older women. If you look at the woman in the left side of this picture, where she's kind of got that hump where she's permanently curved over. It's caused by osteoporosis, especially in older folks. The body of the vertebra become porous, and they kind of start collapsing in on each other, causing this curvature. And again, we see it with increasing age. I find this photo really interesting. It's 3 generations of women. The one on the far right with no kyphosis, the one in the middle with a little bit, and the one on the far left with advanced kyphosis. And last is lordosis. We refer to this as a swayback, an accentuated convex curve of the lumbar region of your vertebral column. Causes can be spinal tuberculosis, it can be rickets. Most commonly, it's a temporary load up front. So we see this rather overweight gentleman, and his lumbar region is kind of curved excessively. We see this in pregnant women, heavily pregnant women. The reason for this is to bring the center of gravity back over the pelvic girdle, but unfortunately, it can lead to very painful back issues. Right? Now, that's the end of our skeletal system, and we'll pick up next with our muscular system.